Good afternoon, everyone, and welcome to those of you that have just joined us. Welcome to this webinar to share the findings from an evaluation of Lambeth's Parent-Infant Relationship Service. My name is Laura McFarlane, and I am the Director of LEAP and will be chairing this session today. We're really excited to have everyone here today to share the findings from City University of London's evaluation of our PAIR service. I am especially proud to welcome you to this webinar this afternoon. As one of the 5 lottery-funded Better Start sites, we are extremely fortunate that we have been able to establish a parent-infant mental health team in Lambeth. As this is Infant Mental Health Awareness Week, where we are being asked to speak up for babies, we're really excited to share the findings of our research with you and contribute to the evidence base for this vital work. So about today's session, we're going to hear from Dr. Eleanor Orlando from the City team about the key findings of the evaluation, followed by a panel discussion with some members of the PAIRS team and other people who have been involved in working alongside us with this service. So on the slide now, you can see the panelists that you'll be hearing from later. Just a few bits of housekeeping before we get going. As you might have noticed, we are recording this webinar so that it can be shared more widely once the session has ended. The presenters and/or panelists will be the only audio or video interaction throughout the session. No other participants will be shown or heard. But please do, throughout the session, feel free to use the chat for general conversation, but also please do use the Q&A section to ask any questions. There'll be 2 moments where we'll respond to questions after the initial presentation and then again after the panel discussion. Following the session, the report will be sent around by email in the next few weeks. And we'll also be sharing a small survey at the end of the session to help us understand what worked well and how we can improve any future sessions. So I want to say a few things about LEAP before we launch into hearing from Eleanor. So Lambeth Early Action Partnership was established in 2015. We're a collective impact place-based initiative funded by the National Lottery Community Fund in response to their ask of local areas to develop a portfolio of services that addresses the needs of women during pregnancy and children up to their 4th birthday. We developed our programme in areas of Lambeth where young children experience greater inequalities. And you can see the map of the area that we cover there, which is roughly around 20% of Lambeth. So 43 of our LEAP neighbourhoods are classified as most deprived, and 68% of children live in very deprived households. And you can see the data reference there. The PAIRS team was one of the very first that we implemented as part of the LEAP portfolio. We had established partnership agreements with the South London and Maudsley NHS Trust and began working together to establish the team and develop a delivery model for infant mental health. As part of this development stage, local parents and practitioners were involved in shaping the service, and parents were very much involved in choosing the name. The team has gone from strength to strength, increasing awareness of the importance of promoting positive early relationships and well-being for babies across Lambeth. I'm extremely proud that the PAIRS team have been recognised by winning an award from the Association of Infant Mental Health. This was an award for a team working to make a significant contribution to meet the emotional needs of infants in their community. So we are now going to play a short video just to bring the service to life for you before we hear about the research.
The parent-infant relationship is perhaps the single biggest factor in terms of the future happiness and health and safety of Lambeth babies. So it's absolutely crucial. There's no better argument really for us as practitioners, professionals and as parents to be identifying early difficulties in the parent-infant relationship, thinking why these difficulties might be there, and then planning and offering services and interventions which really address difficulties in the parent-infant relationship.
PAIRS is the Parent and Infant Relationship Service, and we meet parents and infants from 0 to 4, so from pregnancy up to the age of 4. We work with parents, mothers, fathers, and we really help people to think about the relationship that they have with their baby and their infant. The struggles, the difficulties, the anxieties that they might have that are often quite ordinary, but sometimes can feel not ordinary. I think particularly when parents can feel quite isolated. So we help people with the relationship, and we do that through one-to-one sessions, which is just with a clinician and the parent and the infant. The baby is always there and always present. Or we offer groups, so we have a Together Time group, which is parents and infants together, and that's really a space for parents to come and share their experience really of what it's like to be a parent, the transitions, the changes, the difficulties, the happy bits, the not so easy bits really, in a safe space with other parents. And we also offer a Circle of Security group, which is really about thinking about the relationship again between parents and infants and what a parent brings to that relationship in order to help the relationship to feel more secure and safe for both parents and the infants.
An example of a way that PAIRS can help you is thinking about some of the challenges currently. Maybe if you're having arguments at home and you're finding it difficult to parent your child, you don't understand why your child might be having tantrums, your child might be having sleeping difficulties or feeding difficulties.
One of the key ways that we work at PAIRS is by trying to create a team around the parent-infant relationship. So no single intervention, no single practitioner can really meet the needs of children and babies and their families. So that team working across different services, across different practitioners is what's going to help families the most. So an everyday part of my job really is linking up with Better Start workers, people from health visitors, midwives, adult mental health, all thinking together about how we can meet the needs of the baby and how we can support the parent-infant relationship. At PAIRS, we love to support practitioners in their thinking around working with families and the parent-infant relationship, and we offer consultations, which is basically reflective thinking space for a practitioner, and we offer that to practitioners across Lambeth. And we also offer training and professional development opportunities for Lambeth professionals.
I think it's definitely helped me to kind of build my confidence, especially as being the first time mum, and being more child-led in my approach and kind of my interactions, and it's enabled me to kind of understand my child a bit better and what could be going on for my child. It's also helped me to kind of engage with other parents and meet other parents and share my experiences with other parents, which has been quite nice and reassuring to know sometimes that I'm not alone in some of kind of what you kind of go through as a mum.
I felt for what I was going through and what I was experiencing.
Wasn't the end of it. There are a few more seconds at the end, I think.
I hope that's given you a bit of a taste and an insight into how PAIRS team deliver the service in Lambeth. So I'm now going to hand over to Eleanor, who will talk through the evaluation findings. Thanks, Eleanor.
Thank you, Laura. Let me share my screen. Can you all see that?
We can, Eleanor, thank you.
Great. Good afternoon, everyone. My name is Eleanor, and I'm presenting on behalf of the team today. Some of our findings, some of the key findings from our evaluation of the PAIR service. I'm doing this on behalf of the team, so Dr. Bethan Hatherall and Dr. Rose Meads here at City University of London, and we also have some expert advice from Bronya Arnott, Karen Bateson, and Sally Holt as well. So thank you to them. So in terms of giving a bit of background to this evaluation and this work, it's very, very simple. We need more high quality evidence on the local impact and context of parent-infant relationship teams. We're in a very positive environment at the moment in that the teams around the country are increasing, but with that we still need to understand the local impact they might have and the context that they're working in. So we're all working in different contexts. And obviously then learning from hopefully from PAIR, learning from other services can then help implement future services as well. It's very relevant now because of the Start for Life programme being implemented, especially with their focus now on perinatal mental health and the parent-infant relationship as well, which obviously comes with a bit of funding, which is positive. So the invitation to tender for this evaluation was published in October 2023. We won the job and started evaluation in December 2023 and we completed in April 2024 when we sent the final report. Okay. So I think the video did a fantastic job of introducing PAIRs to you, so I'm not quite sure what else I'm going to add. But I think this pyramid is quite helpful in a way to think about PAIRs and different layers of work that they do. So PAIRs is hosted by the South London and Maudsley NHS Foundation Trust. They sit within CAMS. And they work on different levels. So obviously the universal level here is about putting the baby into focus, promoting infant mental health, and improving understanding and awareness in the community about attachment principles, parent-infant relationships, etc. And then in the middle tier, we've got targeted universals. This is where the group-based intervention sits. So you've heard about Together Time and as the therapeutic parent-infant group as a close group, so that's a little bit different from other parenting groups. Obviously, then also these are doing supervision, like we mentioned there by Ben in the video, of babysit facilitators, those facilitating social security parenting, and also some Together Time groups. One of the big parts of PAIR's work is also workforce development and support, providing consultation, providing training, providing supervision, and to really help build a team around the parent-infant relationship. And then here at the top, we've got the specialist tier, delivering specialist assessment, delivering parent-infant psychotherapy, consultation to professional networks, national networks, local networks. There's also a practitioner who provides VIG, which is a video interaction guidance, and the VIP SD. Let me just check my notes because I never remember what it's called. Is the video feedback intervention to promote positive parenting and sensitivity. That's the one. So there's a huge amount of work this team does, and only with about 8 members of staff for this were at beginning evaluation, and not all are full-time either. So in terms of methodologies, what did we do? So we conducted interviews and a focus group with 15 parents in total. 6 of those had taken part in parent-infant psychotherapy, 8 in Together Time, and 1 parent had taken part in both. They were all mothers, apart from 1 who was a father, different ethnicity, different age groups. They were all interviewed postnatally, and most of them were first-time parents. We also interviewed and conducted a focus group with the PAIRs team to ask them about what it's like to delivering PAIRs and everything that they do. We also conducted interviews with 10 different stakeholders. They came from a wide variety of fields such as mental health, commissioning, health visiting, midwifery, and other closely associated services. And they had experience of supervision, they had experience of referring parents to PAIRs. They also had experience of working with vulnerable families and other sort of things that are sort of very closely related to what PAIRs do. All those interviews and focus groups were transcribed verbatim and analysed thematically using NVivo. We were also provided with, so we didn't collect this data ourselves, but we were provided with from PAIRs and LEAP quantitative data, both from the referrals, so who referred to the service, and also engagement data. There was also some outcome data collected, so from the parental reflective functioning questionnaire, from the DCO5 levels of adaptive functioning, and also the mothers of object relations scale as well. So with lots of different data that we managed to engage with and get a hold of, which is fantastic. So I wanted to start some of my findings. I was starting from the bottom here in terms about the workforce development support, and because I think this is where it really begins. And I think it's really important to sort of the first key finding here is that pairs. It was so clear that they definitely have increased awareness of the infant, of the baby, target that baby blind spot, and focusing on more awareness of parent-infant relationship through the work that they do with the local community, with the local early years workforce. So here's just a stakeholder saying exactly that, in that the team has been very effective, increasing infant mental health, parent-infant relationship information. And that public health message has really come through, which is fantastic. But much more than that, the team has also increased capacity within the early years work. And what I mean by this is that they, through the provision of the reflective supervision to early years workforce, the baby facilitators, COPs, and together time, but also through the consultation to mental health services and CAMS, really increasing capacity in that, and the understanding of other healthcare professionals, like practitioners, in terms of what does a poor attachment look like? When are we concerned about this parent-infant relationship, and then what can we do, both within their own capacity, with their own workload, but also when is it time to actually reach out and refer a family to pairs? So the benefit of this was absolutely unanimous and was very positive. And here again is two quotes from two different stakeholders that we interviewed. One saying a reflective space is very, very helpful, because sometimes you can miss really important things running around. Everyone has a high workload, everyone's stretched. And the second quote is saying that it's very helpful having someone to discuss cases with, also help us see a different perspective. So really expanding their understanding and perspective on understanding a family in the circumstances, especially with the focus on that baby, but also someone that we can refer to if we need them. Another way to think about capacity building in the local ecosystem is, of course, to think about service referral. What we found was there's a wide range of referrers. So this is the data for parent-infant psychotherapy, who has been referring for the last couple of years, from 2015, so from inception to the latest data. And we found here, and this is one of my big highlights from this talk today, 21% of those referrers was from midwifery. And looking into that data a bit further, it was mostly from the continuity of care team within midwifery. Now that's quite unusual, but then obviously when you think about the context that pairs works in, that makes a lot of sense. So pairs being a LEAP service to some extent, and also the continuity team also being a LEAP service. There was a clear communication and collaboration there, because both belonging to the LEAP and all that facilitates, but also in terms of what midwifery continuity care teams do is, firstly, they work with vulnerable families that are potentially more likely to have a poor relationship with their infant. But secondly, they build a relationship with that family, so they're more likely to actually identify that poor attachment. But they also have that relationship with the family to then to refer them in a sensitive way, because they have that rapport building. So in that context, it's not at all surprising that a lot of referrers came from midwifery. We also have, of course, your other usual suspects in terms of referrals to these kind of services, such as health visiting, people working in children's centres, such as start workers, some self-referrals, GPs, other LEAP services, CAMS, and baby steps. And there's also adult mental health services also referred. That's really fantastic, but what we're going to go next from that, well, of course, we want to look at engagement. So here is data on the increase in appointments over the years, again from inception, where there's about 97 parent-infant psychotherapy appointments, and here you can see a linear increase until our latest data from 2023-2024. A bit of a blip, 2020-2021, we all know what happened then. That was COVID. I think that happened to all services. But other than that, a very, very positive trajectory moving into an increase in appointments. So that moves us on to engagement. So who actually engaged with the service? So very much mirroring who we were interviewing. Majority by far is mothers, so 97% for infant psychotherapy, 95% for Together Time. Together Time is a postnatal service, so everyone engaged now postnatally with parent-infant psychotherapy. Obviously, one of the highlights here is that 74% of those accepted referrals were made antenatally. So a large extent of the people that the parents that they're working with, they work with antenatally during pregnancy. Another important finding, and this sort of alludes to what Laura was just telling us about in terms of Leaf and who lives in the area that Leaf works in, is a very multi-diverse community. And here we can see about 15% of families or parents who engage with parent-infant psychotherapy also identify as Black Caribbean. About 12% of parents identify as Black African. And I think this is probably higher than many other services. And just to say that we have this kind of data for Together Time as well, it's not quite the same in that white British and white other was by far the biggest majority there in terms of groups of ethnicities for Together Time compared to parent-infant psychotherapy. Another thing that we talked about, especially in the interviews, about engagement and talk about disadvantage. And the interviews, both the pairs team, but also in terms of the stakeholder we spoke about disadvantage. They described, different families that face several different disadvantages. And those include things such as poverty, poor housing, but also unstable housing, in that families were moved around both within the area and also outside the area during this time. There was quite a few examples of recent migration to the UK, which is then also associated with potential trauma from that experience, potential language barriers as well. There was definitely a lot of mention of mental health issues from these families. Social isolation was quite prevalent, mentioning of intimate personal violence, and also baby loss and current previous trauma. And again, this idea of baby loss and trauma, I think that just sort of speaks to what we see at the moment. For example, from the All Parliamentary Party group, looking at birth trauma that came out a few weeks ago, we see that there's certain communities that are more likely to have these experiences, such as those living with disadvantage, deprivation, or certain ethnicities. So here again, two different quotes from two different pairs team members. One of them are talking about knowing the simultaneous needs happening for their family, being very aware what else is happening with that family. And this other quote saying it's almost like a luxury thinking about relationship for families, when really what the priorities are thinking about housing, thinking about where food is going to come from, what about benefits, for example. So that really sort of, I think, contextualizes and explains the families aspect well. Then thinking about working with these families with a disadvantage. The first thing that comes to mind is sort of the flexible working and considering family circumstances and needs. And we talk about flexible working, but it's more than that. It's about understanding families' context and their circumstances and where they're living in right now, what the priorities are right now. And that's so important. And pairs really show they were very aware of that. So, for example, things such as time between appointments are very flexible, depending on family circumstances. Again, this is for that parent-infant psychotherapy, and the contact could take place face-to-face or at home, depending on what was most suitable for that family at that time. There was also a lot of mention in interviews by close collaborative working, including obviously appropriate referrals, but also in terms of initial assessments of their family, thinking through, is pairs the right thing to do right now? Should we pause it? Is it other priorities this family needs to deal with first, for example? But also then throughout the process of supporting families throughout intervention. And that included things such as establishing clear pathways of communication, especially if the services working with the family at the same time, but also attending meetings such as child protection conferences. And when we think about, for example, safeguarding, this comes back to being, close collaborative working is so important to have different pair of eyes, different people supporting the family appropriately. And again, another quote from a pairs team member saying, you have to think about what other services meets the needs of this family right now. And then thinking about how working with families with disabilities comes across, so from what the priorities are and the key mechanisms, I guess, from the family's point of view. So this is from the parents themselves. And here was very clear, specifically from the parent-infant psychotherapy, about the importance of feeling heard, feeling listened to, about feeling seen, about feeling supported, and how that all helped build a relationship with the practitioner and feel like they were working together. And I think this is especially important for families that are potentially engaging with different services at the same time, whether they might not necessarily have that feeling heard or feeling seen, but then pairs provides that. And that's even more important than if other services also provided that. Hopefully that. So this is a quote from one of the families that we spoke to, saying like, we're here to help you. I want to make you feel comfortable, which is fantastic. With Together Time, that findings from those interviews showed those it really provides a sense of community, so, providing support, parenting confidence, learning about child development. But it was also about that social isolation as well. And I think this is the key bit of Together Time. Well, one of the key bits of Together Time is the fact that it's a closed group. It's great to come and see the same people every week. You build relationships that way, and it's very different from other postnatal groups, for example, where there's different faces every week. This is the same faces. It helps people open up and share more personal things than they might do otherwise. So both very important. Okay, and then moving on and thinking about outcomes for families. There are some immediate benefits, and again, this is consistent findings throughout the interviews for all 15 parents. Improved parent-infant bonding, first and foremost. It was very clear in terms of how they felt like they understood the baby now, in terms of how they can see how they get more reflection on their own behaviour and how that might impact on the infant as well, and the attachment and the communication with infant. There was definitely a lot of examples of reducing isolation, building confidence, and that in particular from Together Time. Feeling heard was also very important in families, able to sort of help them reframe thoughts and developing coping strategies for things that they're dealing with in their lives, obviously, that also impacting on that parent-infant bond and relationship. All of these confidence, these reframing of thoughts, the coping strategies also helped siblings and other relationships, benefits for other children in the family, for example, but also relationships with extended family. And also it helped parents get the confidence to engage with other services as well, which we know is very important. Let me just show you 2 examples of that, which I think is really powerful. So here's the first quote. It's of my parent who took part in Together Time. I'm not always jumping to fixing things. In my case, my baby's crying. I try to see what really is the reason behind it. Try to think what is his thoughts might be, and it's just a different approach that I have nowadays. I think that's very clear. That's something that they've gained out from Together Time in the interview. But another quote here is from a stakeholder who had been working with a family, and the family had also been working with pairs at the same time. And she talked about how there was not much interaction with the baby to begin with, and then throughout working with pairs, she saw a difference there. They started to interact differently, she talked differently about the baby and to the baby, and you can see there's an attachment that was forming that might not have been existing before they started working with pairs. So all these qualitative evidence, I think, is very clear and very consistent throughout. They are quite consistent with other service evaluations as well. In terms of quantitative findings, this is data from Together Time. Excuse me. And these are all statistically significant differences. So an improved from before to after. So improved ability to understand and respond empathetically to the emotional needs of the child. Parental warmth increased, and the parents reported they found baby less intrusive, less controlling at the end of Together Time, but also there was very little change in the level of adaptive functioning. Now, these assessments were also used with psychotherapy, but the data wasn't, we don't have the sample size of that, so it's inappropriate for us to do quantitative analysis. Okay then, so very quickly, some strengths and limitations and reflection of this evaluation. I think it's a huge strength that we interviewed both those delivering and receiving peer support. It makes we can triangulate and compare and contrast findings. We combine qualitative and quantitative findings on the impact of families, which is again very, very helpful and important. A limitation I need to acknowledge is there was no interviews with pregnant women. Obviously, with parent-infant psychotherapy, the majority of services that they were working with were pregnant women. We were not able to interview any of those because of systems at our university, nothing to do with pairs. And in terms of reflection, I was trying to sort of think about how to phrase this best, and then I found this quote, which I think summarizes really well. And just thinking about the evidence that we're collecting in these service evaluations. So, and this is a PAIRS team member, and they were saying that the quantitative bit doesn't really capture it. You know, there's a focus, they would have a feedback form, they're saying, oh, it's really nice, nice biscuits, nice facilitators. But it's not until they actually speak to someone saying, oh my God, it changed my life. And I think that again comes back to the importance of actually combining qualitative and quantitative findings. And then finally, my final slide here, just to summarize, our evaluation clearly found that pairs cannot be successful without its interconnectedness. So thinking about the 3 layers in the pyramid, you can't just take one and not the other. The sum is greater than all its parts. So we really need to take it all together when we're delivering a service like a parent-infant relationship service. We found that pairs have been very successful, clear benefits to the families that are engaged with the service, huge benefits to the professionals as well. They've raised awareness of the baby in focus, increased reach in terms of referrals and appointments. They are reaching pregnant women, most likely through a very strong collaboration with the midwifery continuity team. And they also work with families living with disadvantage and doing that in a very multi-collaborative approach. Thank you. That was all I was going to say. A little bit over time, apologies.
Thank you very much, Eleanor. That was fascinating, and thanks for taking that through us. There are a couple of questions floating around, but if I can just ask you one quickly first. As an evaluator, what advice would you have for other people evaluating this kind of service, and what were the challenges and opportunities of this study?
Yeah, that's a good question, Laura. Thank you. I think what I sort of alluded to there at the end, I think the importance of collecting both qualitative and quantitative evidence, if you can, is really important. And in terms of qualitative, speak to as many people as you can to really understand excuse me, the context the service works in. I think that's really important. And you know, if you, for example, if we just look at the referral data alone, obviously the midwifery being one of the main referrers, that would have been looks a bit strange because that's very unique, that's very uncommon. But then obviously understanding how LEAP works and the continuity of care teams that work in the local area, that all kind of just make absolute perfect sense. So the understanding context is really important. I think it's also really important to sort of have a very clear and good communication and relationship with the funders, such as yourselves, and obviously with PAIRS. So we've had fortnightly meetings throughout the evaluation, which has been very, very helpful. And again, just sort of to contextualize as we are getting findings to understand them better. And then I think finally, I think it's important that to recognise there's always going to be families taking part in these types of services that we are not going to capture in an evaluation. So we worked very closely with PAIRS to identify the families that we should be contacting to ask about whether they want to take part in the evaluation interview as well or not. And there was clearly there was families that the PAIRS didn't feel able to ask because of their circumstances and where they were in their therapeutic journey, etc. So I think, if anything, the benefits are probably better and stronger than what we identified here, because there's a group of very vulnerable families that are benefiting hugely from this. But because they might not have been found in the quantitative data, they're not quite in the qualitative data. That's just a bit of an unknown factor element. But yeah.
Yeah, thanks for that, Eleanor. I think it really does raise kind of sensitivities within this work and the kind of challenge of understanding, you know, how parents have received the service and what difference that has made, because it is wrapped up in that kind of therapeutic approach and that process.
Absolutely, yeah.
Thank you so much for presenting that. And yeah, I think we're going to now move on to our panel discussion. So thank you so much, Eleanor. That's very, very useful. Okay, so I'm now going to hand over to Emily, who is going to take us through our panel discussion.
Thank you, Laura. Sorry, everyone, we're Laura sitting next to each other, and just I'm needing to use her microphone. Yes, I was just saying thank you to Eleanor for the overview of the learning from the evaluation, and that it's been really exciting for those of us working in or with pairs to be having the team at City looking at the service in depth and producing these findings. So I'm Emily Hamblin, Public Health Officer at LEAP, leading on our social and emotional development strand of services, which includes pairs. And I've worked closely with pairs supporting the services implementation over a number of years now. So I'm pleased to be chairing this panel, which includes Laura, LEAP's director, who you heard from at the beginning, Melissa Kelsey, the clinical service lead for pairs. Is there a problem with my video? Okay.
Oh, okay.
Thank you. If other panelists could also make sure that their cameras are on now, that would be great. Thank you. So we've got Melissa Kelsey, clinical service lead for pairs, Ben Yo, one of the specialist parent infant psychotherapists in the pairs team, and Leanne Pitt, who is parenting manager at Lambeth Council. So we're going to have quite a kind of professional focused discussion today about the experience of working to embed pairs in this Lambeth context. So we don't have a parent on the panel, but as Laura mentioned earlier, the design and implementation of pairs has been informed by insights and feedback from parents throughout. And we hope you felt some of their perspectives come through the film and quotes from the evaluation. So we posted the link to that video you saw earlier in the chat if you'd like to have another look. I'm going to start by asking the panel a few questions, and then there'll be a few minutes to address questions from the audience. So please do use the Q&A function for that. Okay, so starting with Melissa, please can you tell us a bit about how the pairs team has developed over time and how you've built working relationships with a range of professionals?
Thanks, Emily. Hi, everyone. I hope you can hear me okay. Yeah, great. Okay. Yes, happy to take you on it's going to be a short journey of the development of the pairs service in Lambeth and how we have built working relationships. So back in 2016, the service started with 3 psychotherapists and a psychologist. Initially, the team concentrated on setting up early intervention and preventative work from conception to the age of 4, offering one-to-one parent-infant psychotherapy. It was filling an important gap in pre-existing provision, working with a client group who may have traditionally fallen between services. Right from the start, there was a focus on collaboration with local parents via LEAP, community groups and professionals to develop a common language around infant mental health and attachment. It was also understood that to support the workforce to think relationally about the baby, it was important to offer consultation, reflective space and training for practitioners. So early on, pairs established a group offer called Together Time, and this is a universal service that's been offered in children's centres, and it enables families to access psychodynamic support and intervention. So what we've learned from delivering these groups, collecting data and feedback on the model, it's really helped us to build relationships in the community and to support referrals into the service for parent-infant psychotherapy. The group offer was also developed further, and the service now offers Together Time group-specific training locally and also nationally, which is important to mention. And we continue to actively engage with other parent-infant teams to support and share good practice. Pairs has also been instrumental in the setting up of circle of security parenting groups within Lambeth. And this has evolved from a small scale service offer to working in partnership with the Lambeth parenting team. And we've got Leanne sitting with us on the panel today. And also children's centre workers, Better Start workers, to deliver a borough-wide group offer to families. And that also includes Together Time on that parenting portal within Lambeth. Pairs has offered regular reflective space to co-facilitators, delivery groups in the community, and this has helped us to really foster stronger partnership working between children's centres and other local authority services. Pairs has continued to support many different professionals who wish to access therapeutic support and thinking about this kind of relational work. We provide borough-wide consultation for professionals, and this has increased to include children up until the age of 5. So when we started, it was 4, and it was in certain wards, and now it's borough-wide and up to the age of 5. We have developed a strong collaboration with caseload midwives, supporting referrals for the one-to-one parent-infant psychotherapy, and that's something we've been quite excited about and we're continuing to develop. We also work closely with health visitors, as I mentioned, children's centre workers as well, perinatal, mental health practitioners, social workers, and so many more local workforce organisations. We attend team meetings face-to-face and online, offering formal and informal presentations, information and resources to all professionals. We've developed a package of training centred on parent-infant relationship and child development with an emphasis on supporting professionals to think baby. And I could go on about that, but I think time is limited. So just to kind of wrap it up a little bit in terms of the question, the service has grown to become a specialist multidisciplinary team embedded within CAP that now includes social workers, STEM and under 5 specialists. And we really do enjoy working collaboratively to continue to expand our thinking and development, supporting and strengthening the relationships between babies, their families, and the workforce in the community. So I hope that's answered the question.
Thank you. Thanks, Melissa. Okay. I think it'd be great now to get a perspective from Leanne, who's worked with Pairs for several years. So from kind of from outside of Pairs, what it's like to work with the team. So Leanne, first you were Deputy Manager in Children's Centres, and more recently you've been managing parenting programmes for Lambeth Council. So can you just tell us a bit about that experience working with Pairs?
Yeah, of course. Firstly, just to say hi, everybody. It's good to be here today. Thank you so much for inviting me to speak on the panel. I suppose I can speak to my initial experiences of working with the Pairs service, kind of as Melissa touched upon, and as you have, Emily, when I was based in children's centres. I actually started as a Better Start worker initially and then as a deputy manager. And what I observed in that time period was that collaboration was really, really important, because it meant that the early years workforce were trained in the model of circle of security, and as a result developed an increased confidence and an ability to support the parent-infant relationship, not just while delivering groups, but also whilst working with their own families, with caseloads, or just in day-to-day interactions in stay and play settings and so on and so forth. I think because the early years workforce have daily access, ready access to families from a range of different diverse backgrounds, and often from multiply disadvantaged circumstances. I think this collaboration was really key because it increased scope for the work with these families, and I think it also went a long way to embedding their trust and building their trust and then embedding it to kind of engage with mental health services that prior to might have felt quite tricky. That introduction via the early years workforce and them having familiar relationships already was really a nice segue in. I can also speak to my experience of having reflective supervision in that context when I have been delivering, co-facilitating the delivery of circle of security groups. And I just want to sort of comment really on how supportive a space that was. It felt like a safe space to really be able to reflect on what was happening in the course of groups, and often sometimes I would be having families on my caseload who then might also be in attendance at groups, and it was really useful to have that space to think through what might be going on for that family, what might be going on for that baby or child, and then trying to really think together about the best strategies that we could use to support those families. So obviously now, as Melissa said, Circle of Security has kind of been adopted by Lambeth. And this has been hugely positive, I think, not only on my current team, but also on the wider workforce. This kind of, as a result of this system change that we've had around what parenting support and services are offered in Lambeth, kind of universally, in terms of both how we work antenatally, so really thinking about what happens, you know, before babies arrive, like really bringing that into focus, because the relationship really does start there, and then really trying to kind of embed that in our practice over time. And then obviously more recently, the parenting team are working with pairs on the scaling up of Together Time. So previously it operated in specific of Lambeth in the LEAP wards, and we're now working together on really scaling that up so that it's an offer that's available across the whole of the borough. And I mean, as has been spoken to, and as I've just kind of reflected on, I think this partnership that we've experienced of working together and collaborating in the kind of delivery of Circle of Security really evidence the success of this model of collaboration, and it really makes a lot of sense that we would repeat that in the process of, again, upskilling our workforce in the parenting team, continuing with that co-facilitation model with us and with pairs, and then that ongoing supportive supervision structure to embed Together Time across the whole of the borough. So we're kind of really excited to continue to do that. Hopefully that answers the question.
Yeah, absolutely. Thank you, Leanne. Coming to Ben next, and Melissa, if you also want to come in. It would be great to hear any personal reflections from you about how Pairs has worked to reach and respond to the needs of local families in this context, as Leanne was talking about building relationships with families, and kind of how Pairs has worked to reduce inequalities.
Thanks, Emily, and hello to everybody there. Thanks for joining. So I think it's been a huge achievement and privilege, really, to be helping some of the most vulnerable babies and families through our parent-infant psychotherapy offer. So some of these parents are facing significant trauma, neglect, abuse, loss in their own childhoods, in their previous birthing experiences, in their interactions with maternity services. And I think that, combined with some of the complexities and kind of poverty, unsuitable housing, means that in Pairs and other LEAP services, these parents haven't been able to build the parent-infant relationship they desperately want to. And also the babies that we see who are kind of impacted, even traumatized by these early disruptions in the parent-infant relationship. And to have the opportunity to intervene as early as possible, I think people have mentioned as a theme of today, antenatally. You know, research shows that the quality of parent-infant relationships before birth, there's a correlation between the quality of post-natal parent-infant interactions, and therefore really for the development of that baby and young child into adulthood. And families tell us that they feel heard and understood and helped. And this is huge. You know, these are babies who face the greatest health inequalities, particularly from Black, Asian and multiple ethnic backgrounds. These are families who have been holding trauma and distress for many years and who might be apprehensive or even suspicious of accessing mental health services. So it's been amazing, really, to be able to offer kind of true people-centered, person-centered, trauma-informed care for these families through our parent-infant psychotherapy offer and through our therapeutic parent and infant baby groups, Together Time.
Great. Thank you, Ben. Okay, I'm going to move on to the next question just because of time. So this one's for Laura. So there's an increasing focus on parent-infant relationships at a national level. Can you share some thoughts about how this kind of growing momentum around parent-infant relationships has had an effect locally, and kind of any aspirations for the future?
Yeah, thanks, Emily. I mean, obviously, at the beginning, we are really proud, kind of initiated this journey and developed this team starting really nearly 10 years ago. So we've had a quite a long time to think about how we develop this work. And we very much welcome the start approach and the funding that has come to some local authorities to really start to embed and kickstart some new initiatives within local authorities. So it's really the increased focus on, as Leanne mentioned, reflective supervision and the kind of value of that for, you know, across the children's workforce. Would that we could do that kind of more widely, but this funding at the moment is giving us an opportunity to focus on that. It's given us an opportunity to develop a group work, which you've heard about, together time and cost. And we are using that investment to look at kind of co-facilitation models so that we can spread across the children's centre workforce and other members of the workforce the skills and competencies of kind of working in this way. So we really, you know, absolutely welcome that. We're obviously keen to see further investment and further light being shone on the valuable nature of this work. That's why we're, you know, really pleased and welcome the findings of the evaluation. And as Melissa said, you know, really now from working in 4 wards in Lambeth, this approach and the team are now working borough-wide. We're offering service for children up to 5 years old. So we really feel that we've got a very strong basis on which to continue and to develop this and really, you know, that the importance of infant well-being, you know, will be carried on through Lambeth. We know that PAIRS is one of very few parent infant mental health services across the country. You know, there was a report out a few years ago, some of you will have heard about, called Rare Jewels, and we definitely recognise that the work that we've done here is groundbreaking. But picking up on something that Ben said, and it occurred at a conference earlier on this week, I think the work that PAIRS has done to go some way to reducing the stigma for some families of being involved in this work. There was a bit of a gauntlet thrown down to that. So I think that that kind of broadening of the understanding of the importance of this work, the upskilling of the workforce to really start to think about, oh, in that stay and play, you know, is that quite right what I'm seeing in terms of that interaction between that family and that child? So to begin to ask themselves questions and have somewhere like the PAIRS team to go. So I personally am quite excited. I think, you know, we've got Start for Life funding. We know that there's a very changeable political time coming up, but I think let's be hopeful about what comes after that, and that the Start for Life funding and also the ABS sites have collectively, obviously with other partners, are raising the flag and really hearing babies' voices.
Thanks, Laura. Okay. Just before we try and squeeze in some questions, Ben, I'm going to ask you finally, but just for a very brief comment, if you can, because we're short on time. Just thinking about how, alongside your PAIRS role, you work as a clinical advisor for the Parent Infant Foundation. So you've got kind of local frontline perspective and more of a national view. It would just be good to hear what you think about kind of the importance of research like City's evaluation of PAIRS in terms of adding to that evidence base.
Thanks, Emily. I'll talk very quickly. I think it adds to this growing evidence base really about the positive impact of parent-infant relationship teams, and it strengthens that case for an expansion in the number of parent-infant teams across the UK to reach the most vulnerable babies and families. I'd point people in the direction of a summary of impact that we produced towards the end of last year at the foundation. And I think the Lambeth evaluation is in line with that. But I do think it adds something new as well. It speaks to the kind of the dual function of a parent-infant team. Yes, it provides direct clinical interventions, but it also influences, shapes, and actually changes the wider early years workforce. And that is incredibly important in terms of reaching more of the most vulnerable babies and families. I could say lots more. I'm going to put a full stop on it there.
Thank you very much. Okay, so we're very short on time for answering all of the questions, but we will make sure to answer some by email if we can't hear. Just one question, I think perhaps there's one for Melissa, about the role of the social worker in the team and how you work with wider children's social care generally for families on child protection plans, etc.
Okay, I mean, I'll have to be brief. Yes, if you can hear me. Yeah, no, that's a really interesting question. I think this is the fantastic thing about this work. You can be a multi-agency team, and actually we work in varying degrees of complexity. So we do work with children who are on child protection plans, child in need plans, that actually under 5 specialism can incorporate different kind of roles, and social work is definitely one of them, because, you know, there's safeguarding to think about, there's lots of different elements. So I think together to complement each other, but also it's really helpful when you're working with a high level of complexity with families that we work with. And I mean, I could go on, but I'm happy if you want me to expand further to, yeah, Ben, do you want to say?
Can I just add to that, because Melissa's representing those families with most complexity, but also just to say that families can refer themselves into our service. So we're a specialist service, but I do think we cross that range between universal, targeted and specialist kind of complex relational needs, but also families that might be just at the beginnings of a parent-infant relationship difficulty and want to refer themselves in.
Thanks, Ben.
Thank you so much. That was really interesting discussion, and I'm now going to just hand over to Laura to finish up.
Great. I mean, we could be here all day. Such an interesting area of discussion. Thanks for all of you for coming. Thanks to the panel. After the webinar, we will share the recording and any slides along with information as to how to refer to pairs, how to contact any of us for any further discussion that you might want to have. And we would also aim to answer any questions that we didn't have time for today. I know there were a few floating around the chat. We will share the full report via email to you in the next few weeks. And please do, if possible, take time to complete the feedback survey, which will also be shared with you via email. So please do keep in touch. If you want any further discussions or information, we're really always happy to share what we've done in this space. So it just remains for me to say thank you so much. It's been a pleasure. I wish it was a bit longer, actually. And, you know, this is Infant Mental Health Week, and, you know, we now have a report that is telling us, is adding to the evidence base for this work. So it's really very exciting. Thanks for coming, everybody.